I'm honored to be back with a friend of the show, Dr. Peter McCullough from the Wellness Company. Doc, thanks for coming on today.
Thank you.
So I saw something that you put out, and we have some people on our team that were really involved in Lyme disease early on and got it and were persecuted really for saying, I think I have Lyme disease because it has all these other symptoms that docs didn't really want to treat. But you said something recently that almost everyone has markers for this. Tell me about that.
Yeah, we've been shocked to see that, over time, it looks like all of us get a tick bite of some sort. And there are certainly tick-borne diseases, Lyme disease, babesiosis, Rocky Mountain spotted fever, and others. But what's unique about Lyme, the organism Borrelia burgdorferi, is that it installs certain antigens in the body. One of them is called opsinin A that cause chronic illness. There's no doubt about it. People develop chronic Lyme. And, the key is to treat it very early. In fact, in the Wellness Company, we have emergency medical kits that have doxycycline. There's a protocol. If you get a tick bite, within a very brief period of time, if you take doxycycline, you're fine. But once the Lyme organism is installed and we start to get Lyme disease, it causes a skin rash, Todd. It looks like a target, like the red target shopping store. Yeah. So my wife had it. She actually developed a target. And where the tick usually bites, believe it or not, is the back of the arm. It's a place you can't see. And that's exactly where my wife got it. And so it forms a target. And if you treat it right away, in that case, we used 2 antibiotics for my wife. Again, problem solved. But if it's not detected, weeks to months later, there's joint inflammation. It gets into the brain, causing all kinds of neurologic problems. It gets into the heart and actually causes heart block, which requires a pacemaker. That happened in my wife's cousin. People live in the Northeast originally, is where it was originally described, but Michigan, loaded, Minneapolis, Minnesota, and even down through the central Midwest, including Oklahoma and Texas. My wife got it in Texas, actually. So the key thing about Lyme is to make sure you have an emergency medical kit from the Wellness Company, recognize a tick bite early, follow the protocol, take doxycycline to knock it out. If one develops clinical Lyme disease, oftentimes 2 antibiotics are needed. Again, that's covered in the Wellness Company kits. Chronic Lyme disease is a problem, and that's the reason why there's been attempts on vaccination. So there was a vaccine several years ago. It was partially effective to prevent the first case of Lyme, but in fact, it caused post-Lyme syndrome, including joint symptoms, and now a new one recently on focal points. And again, it was partially effective, about 70%, but seemed to cause joint aches. And so, we don't want to give a vaccine to a well person and end up with a post-Lyme-like syndrome. So that's where we are right now. I still think it's about prompt detection, early treatment.
Interesting, because my son had it, and we didn't realize he had it because he didn't get the target. One of my other children had the target, but he came in one night in the middle of the night. He was like, 6 years old, walked into the bedroom, and my wife and I, he's like, do you see that bed? It's coming after me. And he was hallucinating.
Yes.
So it was in the brain, right?
Yes.
It's really,
in the
really
brain.
scary.
It's scary. Gets in the heart. An example, my wife's cousin needed a pacemaker. I mean, it really is a real syndrome. And, medical professionals for the longest time denied it. There was a great controversy of whether or not there was a post-Lyme syndrome. Linked to this can be chronic fatigue syndrome, neuropathies, and finally, all the medical societies agree there is a post-Lyme syndrome. It's a legitimate diagnosis. And once we're past the phase where antibiotics can be used, most of this is dealing with the body's reaction to the Lyme antigen and forms of detoxification.
So let's talk about that. Inflammation is a big deal. A lot of, especially older people, have it. A lot of the stuff there, the treatments that come out today are just to mask the underlying problem. Talk to me about inflammation, please.
So true. Inflammation is what makes our joints sore and stiff. And as we get older, sometimes it's frankly painful, but a lot of times what I think, Todd, is that I just feel old, like my knees feel old. And the big innovation from the Wellness Company are forms of peptides. Now, peptides are less than 50 amino acids in length. We have a topical product that's wonderful, particularly for the knees and the hands, elbows, and that's called TheraBlue. TheraBlue features several peptides as well as botanicals, menthol, and actually methylene blue. That's the reason why it's called TheraBlue. It actually looks like a blue cream. You rub it into your knees and elbows, hands, and boy, does it work. I mean, it's miraculous how much better you feel when you use TheraBlue. It comes in a pretty big pump canister. So I think twice a day on TheraBlue for people with chronic joint ailments is wonderful. And now we have a systemic approach called Regenerate. Regenerate is leveraging topical drops, and we can use up to about 30 drops in a cup of coffee or just a small shot glass or two of water. And Regenerate contains 3 peptides, one commonly used, BP157, that's 15 amino acids inside, KPV, 3 amino acids, and TB500, 7 amino acids. And there's a special aquasome technology that allows these to get into the system. This is wonderful because it's not a drug to cover up pain. It's not a genetic treatment. These are peptides that have a very positive function in the body, and then they're disposed of through our typical reticuloendothelial system clearance. So these are a breakthrough. People who want to fundamentally improve their musculoskeletal health. It's also very good for the GI microbiome.
So if I'm correct, I'm not a doctor, but these are like building blocks that your body can use to repair itself. Am I right about that?
Absolutely. So the body, it stimulates repair. That's exactly what they do. They stimulate repair. They do tend to block various inflammatory programs. There is a whole process called epigenetics where certain factors turn on genes, and those genes produce inflammatory factors. So you have to have inhibitors, and a lot of times that's what these peptides do. There's more and more research suggesting they're very beneficial. The best thing about them is safe. They are very safe. I worry about my patients taking the heavy-duty anti-inflammatories. For instance, my mom has arthritis, and she takes meloxicam, which is a prescription non-steroidal. It's in the family with Motrin and Aleve. And boy, I tell you, it causes stomach ulcers and kidney problems like there's no tomorrow. And I'm greatly worried about meloxicam, Bextra, these types of drugs. I think the safest over-the-counter anti-inflammatory is actually naproxen sodium, the blue gel caps. Well, that would be Aleve or the generic form, which is the same. But it's in a gel cap. This is very important because you want the pain relief quickly, but you don't want the tablet to lay against the stomach and burn a hole in the stomach and cause an ulcer. So I never take Motrin tablets or Aleve tablet. If I have a bad headache, I'll take 2 of the blue gel caps. Naproxen, sodium, blue gel caps. You can get them anywhere.
Interesting. So there's no really, side effects of some of these peptides you're talking about?
No.
Okay.
No, they are free of anything concerning whatsoever. And, they take time. I tell everybody, listen, these are, products that are natural to the body. Give it a good 6 to 12 months and see if that back stiffness and hips and knees, especially the deeper joints, that's hard to get to with various forms of rubs. And I'm thinking about the lumbosacral spine, the hips, deep into the shoulders. People should consider Regenerate. You can only do so much with physical therapy and then the over-the-counter anti-inflammatories. They have their role, and certainly if there's terrible pain, you can't sleep, you can take 2 of them. But you want to fundamentally improve the problems, fundamentally make the joints better. The 2 products are TheraBlue topically and Regenerate by taking oral drops.
Well, thank you. You answered those questions, but I would be remiss if I let you get away and not giving me an update on some of the vaccine problems we're having. I know young women who can't seem to have a child. I mean, cancers, all of that. What's the latest that you're seeing on the, the side effects of the COVID vax?
Well, the first thing we're seeing another marketing campaign for more boosters. And the name of this campaign, it comes out each year. This one is called Cicada. And it's a new version of COVID resistant to all the other vaccines. And I bet there'll be cicada vaccines in the fall. You mark my words on this. Remember, last year it was a razor blade sore throat. Cicada are those giant bugs that emerge and St. Louis and Kansas City, they make so much noise. They're about as big as your hand. And cicada means rebirth or resurrection. So it's almost as if those promoting the vaccines want a re-erection of a very mild illness. Over 90% of us have had the illness. We don't have to worry about it. 81% took a vaccine. Most people are not taking any more vaccines. But what is emerging is an understanding that the vaccines stay in the body a very long time. Pfizer and Moderna now 3.5 years in circulating in the bloodstream. Spike protein it produces lasts again for many years. We need the ultimate spike detox from the wellness company. This is the go-to product. 2 capsules twice a day is the labeled dose. For severe cases, I commonly, under doctor's direction, 4 caps twice a day, delivering 16,000 units of nattokinase a day. A year or more on this to drop the spike antibody levels. You can measure those self-directed at LabCorp. The next product we have, which is a global detoxifen, and this is one I definitely recommend for those who've had Lyme and COVID, is the Ultra NAC. So this is N-acetylcysteine, zinc, selenium, molybdenum, and very importantly, milk thistle, liposomal glutathione, and quercetin. So I read those small fonts without glasses. I'm feeling pretty strong today. But these, Todd, these are wonderful supplements. They go together. It's a natural approach. We advise people to sweat because we know the vaccine and the spike protein comes out in sweat. Right now, these are the leading approaches for people to get through these pandemic syndromes.
Very interesting, Doctor. We'll have you back. Thank you for your time and really informative. Take care.
Thank you.